All right, Assalamu alaikum everyone. We're going to go ahead and get started. May I ask my two panelists who already joined us, Khizar Alam and Dr. Sana Siddiqui, if you can unmute and unveil yourself. Wonderful. Great. I hope you can hear me well.
Yes.
Yeah.
Yes. How about you, Khizar? You can hear me well?
Yes, I can hear you.
Perfect. Perfect. We're just waiting for another one of our panelists. Amna Bird, but she's having some internet issues, so she'll join us as soon as she's able to. So I just thought since we already have some viewers and some audience who've joined us, we could go ahead and get started. So first of all, thank you to both of you for joining us today. A very special thank you, Khizar, to you, because I know that this is a little bit of a hard conversation and you've been very brave enough and courageous enough to join us today. So thank you. Just by way of introductions, I'm going to go ahead and just tell people who Dr. Sana Siddiqui is, but Khizar, I'm going to hand over the mic to you to tell us just a little bit about what you do and what you are. Okay, so Dr. Sana Siddiqui is an adult psychiatrist who works at Khan University. She's also the student psychiatrist over there and has been doing this now for over 2 years. One of the big reasons why we thought we'll have Dr. Sana on board is because she works with this population of young adults, starting from the age of 18 to about 24, 25. And since we are seeing that suicide and suicidal attempts are a little bit more of a concern in this age group, the prevalence is a little bit higher, especially in Pakistan. We thought that we could, benefit from her expertise in this area. So thank you, Sana, for joining us. For people who don't know me, my name is Dr. Ayesha Mian. I am a trained adult and child adolescent psychiatrist. I was at Khan University as the chair of the department for about 7 years. Have just recently moved out and now I'm the founder and CEO of Synapse, Pakistan Neuroscience Institute, which is a sort of a space where we're trying to bring together people from in need of in the need of help in mental health issues. We are here launching this and having this program from the background and from the platform of Sabeen Mahmud Foundation. I'm sure everybody in Karachi in Pakistan knows Sabeen Mahmud, knows about her and knows how passionate she was about youth mental health. And for now, past year or so, we have developed an initiative through her name. A few people have gotten together where the objective is to create a safe space for youth to come and talk about their mental health issues. So thank you to Sabeen Mahmud for all the work that she did, and to Sabeen Mahmud Foundation and her mom, Manaz Mahmud, who's trying to carry that candle forward. Khizar, can I give the mic over to you to tell us a little bit about what you do?
Sure. I'm currently a trainee therapist, trainee counselor at CPPD Pakistan. It's a counseling school here. I also teach improv theater workshops to teens and adults for self-development and coping with anxiety and so on. And I'm also volunteering for an organization called Care for Health, which helps people from lower income group with mental illness reintegrate back into society. But right now I'm just here as someone who lost my sister to suicide 2 years ago.
All right, wonderful. So thank you, Khizar, for being here. And, since you did bring this up, Khizar, may I ask you to tell us a little bit about Nisa, your sister?
Well, she was 20 years old. She was depressed for a long time, maybe half her life, had eating disorders. She was very, very intelligent and very thoughtful. yeah, it's really hard to sort of just give a
Sure,
sound bite
sure.
of an
Of,
entire person.
of course.
But yeah, there is.
Okay. All
Mm.
right. So, is it like maybe we can just go ahead and start with you, and the objective for the session truly is to talk about the process of grief, to understand how it may be different for people who have lost their loved ones by suicide.
Mm.
Um,
Mm.
is it any different? Is it the same? And also then moving on, since this is the Suicide Prevention Month, to kind of get some idea from you and from Dr. Sana as well, and hopefully Amna once she joins us, that are there things that we can do, are there things that we can pick on, and not just at an individual level, but even as a societal level, at a community level, at a national level, are there things that can be done to address some of these issues to move towards prevention of suicide? So let's start with the concept of grief. Tell us a little bit about that process. What did it mean for you? And perhaps a little bit about what might have been the stages that you went through to get to this point where there might be some acceptance of what happened.
Um, yeah, so to sort of talk about my grief, I just have to kind of talk about a bit of my journey right before. Um, so I was addicted to heroin about 7, 8 years ago. And I went to rehab and went through my entire journey of recovery. And
Because I think the video is stuck. Could you? Khizar, we've lost you. All right. So while Khizar is trying to get back, Dr. Sana, could we maybe reach out to you in the meantime and ask you? We were, while the two of us were talking about the session yesterday to try to think about what are some of the things that we can talk about. You very perceptively brought up the idea of language, and the language that we use in mental health, and the language that we use for with patients that come in with self-harm, and the language that we use with families about self-harm and suicidal attempts and deaths by suicide. So tell us what you meant by that.
So, first of all, thank you very much, Dr. Ayesha, for inviting me to this panel. It's a very, very important conversation that needs to happen on all fronts. When we read about, or when we talk about, or when we research about suicide, so one thing that is there at every place is that, one, it's preventable. Okay, so it's a preventable cause of death. So every single one of us have a responsibility, whether we are physician, whether we are family, we are friends, we are community, we are at the national level, international level. So every single individual have a responsibility in playing a role to prevent it. So that is one thing. And how can we do that, and how can we start a conversation about that, about our roles, different roles that we need to play, is how just look at how we talk about suicide, or how we discuss suicides amongst ourselves. What is the language that is being used for people who have died by suicide, for people who have lost a loved one through suicide, and people who are dealing with people who are even just thinking about suicide. So that language that we are using plays a huge role. Either ways, it creates this stigma around the word suicide, and it also can help to reduce the stigma around the word suicide, or anyone who is going through or have come across this word suicide. So that is one thing that I strongly believe, that the words that we use to talk about suicide in any way or form becomes very, very important. So one of the common words that we read in literature, read in newspapers, read on social media is if someone has died by suicide, so you would see the word very commonly, very unintentionally, they committed suicide. Okay, so this word commit might not mean much to quite a lot of people, but it's very, very important that we understand the meaning behind this word commit suicide. So it tells us, it gives a notion of doing a crime. So you commit a crime. Okay, so it's very, very important to be mindful of this, that someone dying by suicide is not a crime. Okay, and then when you make it a crime, then the whole plethora of the thought process behind the act changes. So our attitudes changes. So people do not commit suicide, they die by suicide. So that is something that is very, very important, and it's important for us, for all of us, to be mindful of that do not use the word commit suicide. Another thing that is very commonly seen with the word suicide is suicide was successful, or it was a failed attempt to suicide. So again, it's not about success or being unsuccessful. It's about understanding the thought behind someone who even thought about doing something to them. Um, so so this is exactly what I mean when I talk about understanding the language behind or associated with the word suicide, and be very, very mindful of what words you are choosing to use and associating with it, because it has a huge background to it, and it's very, very important that we mindful of that.
So automatically, I mean, yeah, I think it's just been recently कि हमने थोड़ा सा सोचना शुरू किया है कि हम ये क्यों अल्फाज इस्तेमाल करते हैं committed suicide, right? And of course, you know, we grew up with that when we were in medical school. That was the language that was used all over. Committed suicide, and perhaps has a history coming from the space where suicide or the act of self-harm was seen as a criminal offense, a problem
So
that
was not, yes, okay, it's still a criminal offense.
Pakistan
Yes,
mein,
it is still a criminal offense.
And I will get to it later in our conversation, that you know what is it that we can do from a space of advocacy and stuff कि इसको सबसे पहले decriminalize तो करें इस चीज को. But tell me, as a you were a psychiatrist, you went on to kind of get your training in mental health, but as a medical student, and when you see your other fraternity around you, physicians and all, अगर कोई self harm करता है, or you know, there is an attempt at suicide, they end up in the emergency room, they end up with doctors and nurses. What have you seen? What is the literature around? What is the stigma, and how are these patients treated or spoken to, and what is the language that we all end up using with the family and with someone who's may have attempted suicide?
So it's unfortunate. So like you mentioned that the reason that we use the word committed suicide is that it's a criminal offense. And if we talk about Pakistan, so it's a criminal offense in Pakistan. So अगर हम doctors की बात करें, या हम अपने physicians की बात करें, so most of the time they'll end up in the ER first. So ER में, instead of because it's a criminal offense, so instead of attending to the person who has harmed themselves in some way or the other, in some form or the other, so they would first say that it needs to go to the MLO, so the medical like जो officers हैं, so legal officers के पास, so it needs to go to that. So it leads to delays in the help that we can offer them. Another thing that we hear is, for example, someone is harming themselves repeatedly and they are ending up in the hospital repeatedly, so attention seeker hai, So they are doing it to ड्रामा कर रहे हैं, ठीक है, तो ये तो ड्रामा ही करते हैं. So belittling the or minimizing the impact, the minimizing the effect that it can have on the person. This is something that is very, very common. I've seen it very, very common. So I've practiced in a public sector hospital as well, and in a private sector hospital as well. Both of these were tertiary hospitals, and we would see quite a lot of people who would come with self-harm attempts, or who would ultimately die by suicide. So the attitudes that are there are not very helpful, not just for the patient, but also for the family members who are there, who are very, very concerned and very, very anxious about the person who they're attached to, who has tried to harm themselves. So that attitude.
Right. So I think you're being very, very kind to people when you're saying the attitudes are not helpful. I mean, I think the attitudes are quite horrific. And I think that I think it's important for all of us as physicians and as, first gatekeepers, frontline workers, jo bhi hai, to kind of get that language correct, so that, slowly and advocate for that, so that people can talk about it, and people can, because I do know because it's a medical legal offense, a lot of people will not even say कि इन्होंने ये सेल्फ हार्म था, एक्सीडेंट हो गया या गलती से ये कर लिया, वो कर लिया. तो फिर हमें ना डेटा पता चलता है, ना रिसर्च समझ में आती है, ना हम सही तरीके से समझ सकते हैं कि ग्रेविटी क्या है इस सिचुएशन की. हाउ
not just that, Dr. Ayesha, most of us healthcare physicians, अगर हम healthcare professions की बात करें, so they're hesitant to even ask this question, because एक notion ये है कि you will induce the thought of suicide if you'll ask about it.
Right.
Which is completely untrue. Most of the people who are thinking about suicide would be thankful to you that you asked that question to them, because it's not easy to talk about it. It's not. It's very scary thought that I'm thinking about killing myself. I am thinking that this life is not worth living anymore. So they will be helpful to you if you just ask this question about depression, about are you thinking about, did you think about, or were you thinking about harming yourself when you did that? So even asking this question is very, very stigmatizing, even for healthcare professionals who see these patients routinely. So they are very hesitant. So even in conversations with the patient, that becomes very, very important. As a psychiatrist, I might not be seeing the bulk of patients that an ER physician would be seeing, or a family physician would be seeing, a general practitioner would be seeing. So they would be coming to me when very, very late. So I might not be the first point of contact, but other healthcare professionals, the GPs that are sitting in the clinics in their areas, would be their first point of contact. And research tells us that a person who has harmed themselves would be thinking about doing it almost 100 times before attempting. So if at that the first time they thought about it, or the 50th time that they thought about it, if someone would have asked them this question, it would have made a huge difference. So even just being comfortable in asking this question, and if you are seeing that this person is not looking well emotionally, then just asking this question, how are you feeling? So it's something that is not commonly done, and it's a very, like, it takes 2 seconds to ask this question,
right,
and it makes a huge difference.
Great, thank you, Sana. Khizar, you're back. So you were telling us a little bit about your journey, and then a little bit before this happened, and then what has your journey been since then, since Nisa died by suicide?
Yeah, I'd just like to sort of add to it. I'm sorry, what was your name again?
I'm Dr. Sana.
And also just acknowledging however they're feeling. I think that's also just holding that okay, you're feeling this way, and not trying to change that
Hmm.
when that happens. I think that's providing that kind of safety. We want to rescue, we want to sort of change, aise na feel karo, and there's so many sort of responses we have, and I'll come to that in my own story as well. But yeah, I just wanted to sort of say that acknowledging part. Yeah, so my story was that I had drug addiction, um, and I had a sort of journey into really learning how to accept my feelings when they came. Up until that point, until the start of my journey, I hadn't cried in like 15 years. I was super like, when it came to feeling my sadness. So when the time came, um, I was very sort of um, adamant that I want to feel whatever grief is coming. I had sort of worked on it for a long time, for 6, 7 years in therapy. And so grief was just something that when it came, I allowed it. And that there were certain blocks, right? Whether it was in my family or other people, I found that even when how do you say when so what happened was my sister jumped from our roof, and I was abroad, living abroad, and I I came back and she was in the ICU for a couple of days before she died. And when she was in the ICU and I saw her, came down to the cafeteria and I started crying. And one of my family members came up to me and started doing, bas kar do beta or something like that. It'll be okay, kind of thing. And I was just like, please go away. While as one of my cousins, very gently had a hand over here, and that just sort of, it's like I'm not going to try to change your sadness, but it's okay, and and I'm also here, kind of a thing, and that was just, right. And so during that time, that's what I was looking for. Those people that had that attunement, um, or understanding, you could even say. Um, so yeah, I mean
Yeah.
that's just right
And
out.
a lot of people will say, I didn't know what to say, so I just said it's going to be okay, or itna ro nahi, whatever it might be. But it's also okay to say that I don't know what to say. I
Yeah,
don't have words, right? So I think that that's also an honest response, that I have no way of knowing कि आप के ऊपर क्या गुजर रही है इस वक्त, या आप किस किस दर्द से, whatever pain you're going through. It's hard for me to fathom, but let me know how I can be here for you, or let me know how I can help, right? So then
yeah.
so that,
And sometimes, maybe I just want space,
yeah,
right? So after that, like, I really started, every time someone died, even a week after someone died of suicide, or just generally, I just sort of learned how to understand space, and right, really feeling what the person is sort of feeling,
yeah,
and that doesn't come intuitively to everybody.
right,
um, yeah.
right. So, could you tell us a little bit about the stages of grief? I mean, or tell us about the different sort of, was there anger? Was there,
Yeah.
sadness? Was
Yeah.
there guilt? Was there, like, what are
Yeah.
all the feelings that just come even all at once, or alag alag, or is there a stage कि इसके बाद ये होता है, इसके बाद ये होता है?
So I went straight onto YouTube. Like, this is the second day. I went onto YouTube looking for grief videos. Like, I was in a really and looking at the stages of grief, and then the counter argument of, like, there's no race
Right.
format. It just goes all over, and um, for me, basically, there's just two emotions. There's this grief and guilt, and um, again, there's not really some kind of a recipe. It's just, for me, it was just about holding the grief when it comes, and I kind of move on. For me personally, with my sort of, beliefs. For me, it was the last time I saw my sister when I buried her, and that was it, right? So there's a certain ending, real ending to that, and the depth of that grief and pain. Um, I don't know if that's what's caused my guilt, but I had guilt. I had a lot of guilt. Like, why didn't I reach out, or not reach out, but why didn't I say yes to her, her sort of saying a plan, calling me for a plan or something like that. Just those little three, four things. And I know that what I do know is that even if I had said yes, I would probably find something to feel that way about. And why did I move back? Why did I move back? You know, and therapy and my own process has sort of like helped me realize um, like responsibility. When I was in Denmark for 6 years, I had a sort of trauma therapy there, and the therapist there would always talk about responsibility. Like you're responsible for yourself. And when I spoke to her about this, she was like, "That's a lot of responsibility to take on someone else's, um, you know." And the funny thing is that 2 years before or a year before she, took her life, she came to Denmark where I was living, and she was in a psychiatric ward, and we were going to, we were going to take a walk at some point, and she tried a couple of times to take her life in some way or the other. And I remember talking to my therapist. I was like, "Listen, I really wanna allow her grief, her pain, and her desire to take her life." Um, and but I wanna like express to her um, that I don't want her to go, kind of thing. So how do I? So we came up with this, went back and forth, and I ended up telling my sister that I'm not going to stop. I ended up saying, I'm not going to stop you if you want to go, but I'll miss you. So, um, and that was that. And, you know, and she went eventually. So
Yeah.
it's a difficult thing to deal with. There's not much to talk about. It's just like, for me, it's just like, let the grief come. Okay. Feel it. And sometimes you just got to get up and live life again. And that's the case for me.
Yeah. And my assumption is, and completely my assumption, tell me if I'm wrong, that the grief probably comes in waves, and grief, there are periods when you seem to be doing okay, and then kahin se kuch reminder aa jayega, koi cheez aa jayegi, and then it'll come pouring in again. So there's just not like a linear pathway or linear journey to grief in this instance.
Yeah. Um, I mean, there's a reminder every day. वो तो है ही है.
Yeah.
But some days you can really like. I mean, I'm driving a car, and then boom. If I can't drive and cry as well, right? So it's just like impractical. Sometimes I have to like, oh right, I might be doing something or whatever. But yeah, there's some days in which, I just feel some pain, and I actually when I'm in some of my deepest pain, I actually just send a voice note to a friend of mine in Canada who reached out to me when this was going on, and all he was saying was, "I love you, my brother, and just breathe, just breathe." And that's I've really like, because it gets so overwhelming that my body just starts, and using the breath and just like sort of breathing sort of helps me feel it and contain it and move on eventually. So I kind of found that,
Yeah.
found my own recipe of sorts to deal with things like that.
Right. And it's very interesting that you say breathe, because, I've recently gone through a loss as well. And one of the, as I was describing the grief to someone, that's the exact language that I was using, that it feels like somebody is just submerged me underwater and I can't breathe, right? As if there's like, suffocation hai, saans nahi aa rahi hai. And I have to sort of get out in the open and just kind of take some deep breaths to be able to know that, no, I can breathe again. So it is that sort of visceral sensation that happens in your lungs in some ways, right? That you're unable to breathe. Right. Sana, tell us a little bit about, Khizar's brought this up of, with my experience of some of my patients taking their own lives as well, there is a pattern, right? There is a pattern. 90%, we know that 90% of people who do die by suicide have either depression or another mental health disorder, multiple attempts in the past. So are there one red flags? Are there points that we can pick up and say कि यहाँ पे अगर intervention हो जाए तो we need to be careful? Are there vulnerable times that is stage pick if somebody has, let's say, a history of depression or a mental health disorder, तो उन specifically उन लोगों के लिए ये vulnerable points आएंगे life में जिसमें support की ज़्यादा ज़रूरत है and we need to our sort of flags should go up.
So, I think एक जो चीज़ बहुत ज़्यादा important होगी वो before I answer this question, it would be important to understand that who are these people who can die by suicide. So what are the vulnerable groups? What are the people that we need to be very, very careful of? Yes, we need to be careful about each and every one, but who are more vulnerable, so who can take their lives. So you have mentioned that people who are diagnosed with depression, who have clinical depression. So most of the people that we have seen who die by suicide have a diagnosed psychiatric illness, whether it's depression, and depression is the most common, but other mental health problems like substance use is another condition that makes people vulnerable to die by suicides. Apart from mental health problems like clinical disorders like depression and substance use disorders, anyone who is going through chronic illness, they are suffering for a long time. So going through chronic illness, people who are in chronic pain, like for example, someone who is diagnosed with cancer, and it's a painful one, so it becomes very, very painful. Someone you have diabetes and it's chronic diabetes, debilitating diabetes. So any chronic illness, any chronic pain, so these people are vulnerable. People who have gone through immense amount of trauma, they are vulnerable. So people in the war zone who have been in the war zone, come back from the war zone, are in the constant war zone some way or the other. So these are the people who are vulnerable, who we can think that they might think about harming themselves in some way. So these are vulnerable people. People who are impulsive by nature, who have impulsivity in their personality. They mostly do not think about consequences when they are taking decisions. So they are vulnerable. So these are the kind of vulnerable populations that we need to be careful in when we are dealing with them. And when these people, when these vulnerable population are going through changes in their lives. So in a lifespan, if there are moments or times in their life when they are going through a change, so it can be stressful for them. So for example, you have moved to a new house, for example, it can be a stressful situation. You have been to a new university. Adolescent itself is a vulnerable age group because a lot is changing in you, outside you, in your environment. So there is a lot of changes. So any change, if you're going through any change, can be stressful. And these are some of the vulnerable populations that it can be overwhelming for these people when they're going through any change. So adolescents, the teenage group is something, some people who are impulsive. They can succumb to peer pressure. There is bullying that is happening, that can happen. So people who are bullied, discriminated in any way or form. So any vulnerable population that is discriminated, socially isolated, socially ostracized. So these are some of the people that are more vulnerable, and any change that happens in their life, any significant change that happens in their life can be a stressful point, and a trigger point that can lead to them thinking about suicide.
Just a follow-up question. What about like students of exam stress and all? Puri 3 idiots जिसके around बनी है.
So
how's that in
so students, the academic pressure. So these are all very, very stressful situations. Okay, so if you are vulnerable, even before being in that situation, so that can be problematic for you. So stress of any sort or form can be a trigger point. And academic stress, as we have seen, like Dr. Ayesha deals with a younger age group, and she is very well aware. I see students, so it's something, academic pressure, academic stress is something that is very, very stressful, and can be a point of trigger for people of this age group.
Can you hear, Ayesha?
Sorry, Dr. Ayesha, can yeah.
इस एज ग्रुप में impulsivity भी बहुत ज्यादा होती है. So, you know, adolescent brain is a very impulsive brain. So you may not even want to be, you know, the idea or the thought may not be to die. It might be just an impulsive act. Oh my God!
Most of the time, especially in younger generation, most of the time they don't want to die. They don't want to. It's just that they do something that ultimately leads to death.
Yeah. And concern यही हो जाता है कि you know parents भी यही कह रहे होते हैं कि ये तो हर वक्त यही कर रहे होते हैं, हर वक्त threat कर रहे होते हैं, हर वक्त self harm है. So you know they're not taken seriously, and I know emergency room में तो बहुत ज़्यादा physicians don't take them seriously. Oh my God, ये फिर से आ गए, but it could be that one that moment where they took one pill too many, or the cut was you know a little millimeter too deep or something, and it can actually lead to and exams ka I was smiling Khizar when you said it, because we recently put an Insta post for adolescents, asking them this question that describe stress in 3 words, and one of the responses we got was A levels, right? So it's definitely something, and because you know our whole education system is so archaic, पता नहीं किस ज़माने का है कि हम उसको ना change करने की कोशिश कर रहे हैं ना वो कर रहे हैं. Anyways, Sana, tell us a little bit about support. Tell us how we can support families, and then Khizar, we would like to then hear from you that, you know, is that correct? What we as physicians think this is how we should support, or are there better ways that families could feel supported?
So when I was listening to Khizar when he was describing what happened when he was going through grief, so one thing that is absolutely important, and I think difficult for our kind of society, which are very, very enmeshed, to understand this, that sometimes not saying something is enough. You do not need to, like, as someone who goes to funerals, I've seen this very commonly, that people feel compelled to say something, but I think it's important for us as a society to understand that every single person has their own way of dealing with with loss. So it's okay to let them do what they feel is the right thing to do at that point in time. If they want to cry, let them cry. If they don't want to cry, don't force them to cry, because this is how they deal with loss. You do not need to say absolutely anything. Like as I mentioned that a family member came and say, "Ke sabar karo ya ro nahi, theek hai." And the other cousins didn't say anything. He just made him feel the presence, that there is someone, and it's a safe space, and you can mourn whatever way you want to mourn. At the very least, this is something that we can do as a society, to let people experience loss and feel loss, express their loss in whatever way or form they want to. What we can do as physicians, if we are talking about physicians, is, and Khizar had mentioned this before, acknowledge and follow up. That when I say that it's absolutely important for us to ask about these questions, just 2 questions. How are you feeling? Are you feeling okay? How have you been for the past 2 weeks? Do you feel interest in things that you were feeling interest before? So just these 2 questions. These are very, like, it won't take hardly a minute of your time to ask these questions to each and every patient that you see in your clinic. And then if someone say yes, because हमारी एंजाइटी ये होती है फिजिशियंस की, अगर मैं बात करूं कि अगर हमने पूछ लिया और अगर उन्होंने इसका आंसर yes कर दिया, तो what do we do? I don't know how to handle this. Or if they start crying, so what do I do? So it's better not to ask this question. So because I don't want to deal with it in my clinic, it's a busy clinic, I cannot deal with it. So what do I do? So just being there for them, acknowledging that it's okay to feel this way. And I do understand that it's difficult to feel this way. It's not a good situation to be in, and providing them, if you cannot provide that support at that point in time, then providing them with the avenues that can help them, that can provide that support that you cannot provide. So, for example, referring them to a friend of yours, or if they are comfortable with, for example, you can ask them, who is it that you can talk to about this, because it's absolutely important that you talk to someone about this. Is there a friend or a family member that that can help you or support you, you're comfortable with? Then guide them to them. If they don't feel comfortable with friends or family, then you can tell them that there are professionals who can help you with this, who can support you in this difficult times, and guiding them towards that is something that we can do as healthcare professionals. As a society, we just be okay with the feelings. As a society, we are very, very suppressed. Like we don't encourage showing or expressing emotions. We don't encourage that. So if we can just be okay with people expressing themselves, showing emotions, be okay with that, I think that would be enough. And then on a national level, what our leaders can do, because leadership has a huge role to play in this. So and leadership can not just on the national level, but leadership, for example, in your own household. So the leader of the household, the leader of the school, the leader of the company that you're working with, the leader of your community. So any leader has the responsibility, or what they can do is provide a safe space and have this conversation, start having these conversations, so that people are okay in telling how they're feeling, and they feel validated in how they are feeling. So I think that is something that we can start with, and then when the conversation has started, then we can definitely see how to move it forward.
So Khizar, tell us a little bit about families coming together after there has been a loved one who's died of suicide. I know that this is a tough one. It can break families apart. It can bring them together. tell us a little bit about that, and what's your kind of experience been, and what are some of the reflections that you may have had about this. And while Khizar is answering, if our participants have any questions, please do post them in the comment box, and we'll get Khizar and Sana to answer them for us.
Yeah, I just want to sort of add, just sort of echo something Sana said. And when people sort of in our country or other places as well try to come and change the person's feeling, that when they're trying to protect people from their feelings, I would also like ask them to sort of notice where the urge is coming from, right? Because if you're trying, is it really, are you trying to get rid of your own discomfort, or what's happening there? Because people will cry, they will self-soothe themselves, or they'll ask for help, or maybe they don't. You can offer, I'm here if you need. And if they need, they will reach out, right? So sort of just started kind of sensing what's needed rather than your own thing. That's what I'd just add to that one. Yeah, families can sure as hell go apart as well, in my own as well. I found that when my mom was crying, it allowed me to feel my grief as well. And there was a bit of, there's a closeness that comes from that. It was a bit different from my dad. And people are allowed to grieve the way they want to, and they don't have to express sadness and so on. But I definitely say that I felt closer to whoever was someone, if someone was crying about my sister, or it just brings me closer in that moment. So that's, yeah, I'm not sure what else you would sort of want to know about families and
so just any sense of what families can do, or how they what might make that process easier, or what might
the grieving,
that grieving and post something like that, and what might you suggest for them? Are there avenues that you think helped to kind of process and take care of? So
yeah, I mean, the thing is that each person is different, right? So each person's reaction is going to be different. So it's, I don't know if there's a general thing, but say that if it was myself, I needed space. Like I didn't listen to music. I haven't listened to like even sort of rock music or more softer music for even up till now. But like for 2 months, I was just in a sort of more primal mode. I was just playing squash by myself. And people really learn to sort of respect the space. Whereas on the other hand, those people that sort of kept a sensitive understanding of what I needed, like if I was crying, and didn't try to change it and just be silent, like that's not saying anything is just amazing. Just it's the non-verbal presence that really is, if you can just sort of look in the person and feel your affection to them, they'll know that it's okay. And for example, like I went with one of my friends, because she was so attuned. I went with her to the graveyard, after a while, whereas I didn't go with any one of my family members or older friends even. So again, it's just sort of having, and that's a lot to ask for. I'll say this, like it's a lot to ask for, but to keep it simple. Yeah, just check in with yourself and check in with them and how they're doing, and if they need you, they'll say it, and you can say that I'm here, thinking about you, uh, and when they need something, they'll ask for it.
Right, right. Um, so thank you, both of you. I'm just going to ask one more time for our audience. If anybody has any comments or questions, they can put them in the comment box. There are a number of people who've commented saying that, thanking us for this important discussion. Thanking you, Khizar, for being here and sharing your story. So I truly appreciate that. Um, I do feel that, COVID के दौरान पहले से ये सब हो रहा था, but COVID के दौरान I think the mental health concerns and mental health, जिनको already disorders थे, उनके symptoms have become more severe. They've really gone through a hard time with this. जिनको नहीं थे, there have been people who've developed sort of anxiety, significant anxiety and depression around this. I don't think a lot of people know this, but COVID के अपने actually physical changes that happen in the brain have also shown to cause anxiety, depression, suicidality, and delirium and dementia and all sorts of things. So very neurobiologically, it changes the brain in some ways. जो भी inflammation lungs में हो रही होती है, वो brain में भी होती है, and that is why we are seeing more psychiatric disorders as well. And हर जगह भी कहा जा रहा है कि this is a parallel pandemic, right? So we've of course talked about the infections and stuff, but this is a parallel pandemic which is probably going to stay with us for much longer than when this actual infectious pandemic is over. So I think it's important, बहुत ज़्यादा ज़रूरी है कि जितने ज़्यादा forums हैं जहाँ पे हम एक दूसरे के साथ बात कर रहे हैं, open spaces, we're opening up spaces, we're creating spaces जिनमें psychological safety है इतनी कि लोग इन चीज़ों के बारे में बात कर सकें. Anxiety अपना बता, with unemployment, people losing jobs, and there's so much going on. Jisme, again, sometimes it might feel in not wanting to live maybe easier than wanting to live, and people lose hope. किस तरीके से हम hope दे सकते हैं, किस तरीके से हम conversation इस चीज़ की कर सकते हैं. And so that piece I think is extremely important for us to now come together as a community to have these frank, open conversations. So thank you again, both of you, for joining us here today. Thank you to Sabeen Mahmud Foundation, Sabeen Mahmud, and whatever she stood for, that we are trying to keep alive. And again, we hope to, Khizar, connect with you at some other forum as well, if you're happy to continue to talk about this, because I think ये एक दफा की conversation नहीं है. This conversation needs to happen again and again in different spaces. So really appreciate it, and thank you to all of our audience who was and participants who were here with us today. बहुत शुक्रिया.
Can I just add something?
जी Khizar, please.
So I will also really be an advocate for therapy, for counseling, for psychotherapy. I think that is because there are parents who are concerned but may not know how to communicate with their children. They may not, but they may have the insight or the desire that we want to help our kids, or if it's just an adult as well. A good, decent therapist is a place where you can come and really process what's going on and maybe help reduce the overwhelm, and make life a bit more livable. So
absolutely,
that's what I'd suggest as well.
Thank you so much for saying that, Khizar, because you're absolutely right. And I would want to just add on to this is that a lot of people think that therapy is just talking. It's not. So please just understand that it's not just talking, because people say that हम अपने friend से बात कर लेते हैं या मैं अपने घर वालों से बात कर लेता हूँ. So what's the point of going to therapy? It's not just not just talking. It's not talking at all. So it's really about processing your emotions and your thoughts and getting to know yourself better so that you can manage what is happening around you in a better way. So absolutely important to be open to this idea that there are professionals who are there to help you if you're going through a difficult time.
Perfect. जी बिल्कुल. There's a science and an art to therapy. So and जो therapists होते हैं वो बहुत मेहनत के बाद और बहुत सारे काविशों के बाद और there's a lot of learning that goes into it. Once you come out of it. So it's really not like talking to your best friend. You should have a best friend. You should have a family member. But I think it's important to think about therapy whenever you feel that there's a need. All right, जी. बहुत बहुत शुक्रिया. Thank you everyone. And inshallah we'll talk about this again at another forum.
Thank you so much.
All right.
Thank you.